Yeah, the roads are very curvy and windy, and it's difficult to drive with a compact car, much less a Winnebago.
On a sunny Tuesday morning, Teresa Gardner and Paula Hill Mead are steering their 30-foot RV through the hills of Appalachia. But they aren't on a cross-country vacation. They aren't even that far from home.
This is one of our longer drives that we're taking today.
Teresa and Paula are nurse practitioners, and they're driving to offer health care to patients who might otherwise never reach a doctor's office. The familiar problems of health care in America are magnified in Southwest Virginia by poverty and isolation. And when we pull into Grundy, Virginia, there's already a line of anxious patients, people like Bonnie Hurley, who says she's found herself with nowhere else to go.
It came down to either you eat or you pay doctor bills.
We've got such limited space. And Bonnie, your medication's in. How are you doing, honey? If they saw these people that were crying, a 5-year-old because he couldn't get his teeth fixed, and he said, go ahead and pull them even if I cry. If they saw how desperate the need was, they would know. People that think there is not a problem with health care in this United States are very naive, very naive.
2 years after passage of the Affordable Care Act, millions of Americans still can't afford care. And while the country waits to see if and how the plan will be implemented, for now, the Health Wagon is part of the solution for nearly 4,000 patients a year, between its mobile stops and a small clinic.
Is that the pain from my legs?
Grateful for the free care, patients help out however they can. Mark Mullins has shoveled the clinic driveway. Bonnie Hurley brought pumpkin rolls to her appointment.
The gift I have made you.
This woman spent 3 days crocheting doilies before her visit. It may be a charming way to run a health clinic, but it's based on something hard to replicate, a series of lucky twists and selfless decisions that started with one woman moving here 30 years ago.
Sister Bernie Kinney is just a phenomenal woman. She was a Massachusetts Catholic nun who relocated to Virginia at the request of the Richmond Catholic Diocese. She actually started out in the back of a Volkswagen Beetle because she's seen a need and she responded to meet that need. Across the nation now you see that mobile clinics are starting to catch on, that that other communities are seeing that. But she was truly ahead of her time 30 years ago.
In 2005, with Sister Bernie facing retirement, the Catholic hospital supporting the mobile clinic was privatized, leaving the Health Wagon to find its own funding. So now Teresa and Paula spend their days providing care and nights looking for donations.
If you've got it, watch it. If you don't, call your TV provider to get HDNet today.